Good morning, friends. This short video I will be showing you how I keep myself young and active. This is more of an instructional video, educational video. I am Dr. L. Prakash, an orthopedic surgeon and a scientist, and this is the formula I have used for my bio-reversal session, meaning to become young and stay younger. This includes one session of EBOO, extracorporeal blood oxygen ozonization without plastic filters with high doses of ozone. This is followed by IV bubbled saline saturated with molecular hydrogen infusion. This saline is also blended with vitamin C, vitamin B complex, vitamin B12, N-acetylcysteine and glutathione. I will give you a list of what is being added subsequently in my talk. This is a personal demonstration on myself of probably the highest quantity of ozone administered to an individual in the world. In this demonstration, I tried a dose of 10 lakh micrograms. That is a substantial quantity in a single session. The video will show the detailed, complete procedure step by step. The quantity of ozone directly bubbled into the blood is the highest amongst all available methods known to us. This system does not use plastic renal filters, and as the entire administered ozone is absorbed, no destroyers are used in this system. I have to change the thing a little bit. That's better. Yes. This video shows very clearly every step of the procedure, and of course I am the subject. Number one, the tubings are opened, checked, and the perfusion pump is tested. So here I am wearing gloves. Though the procedure is being performed on me, I am going to prime up and set the things before we start. The waste tubing is first removed and then kept comfortably over the UV stand. Into this tube, the waste will go. We now connect the tubings from the oxygen cylinder to the ozone machine, and from the ozone machine to the ozone in needle, which will go into the bottle to bubble the saline. The perfusion pump is switched on, tested, seen that it works perfectly. The switch is kept at 8 ml, that is the best to start, and you can see the dial rotating. It is rotating in clockwise direction from compared to the chair, so which is ideal for us. And the procedure is started by mixing 4 ml of 500 international units per ml of heparin, that is about 20,000 international units in 500 ml of normal saline. So here I am checking the bottle. A 5 cc syringe is being opened. The needle is switched to a thicker needle, which will eventually also be used as an air vent for the saline bottle. Heparin bottle has got 5000 ml, 5000 IU per ml, total 25,000 IUs, of which 20,000 international units have been extracted. The saline bottle is opened. The 4 ml of heparin are injected, the bottle is shaken fully, and leaving the needle to act as an air vent, the saline bottle is hung on the stand. The remaining 1 ml of heparin is mixed with 5 ml of distilled water and kept aside for later flushing. These days we seldom use it. In our early periods we had a lot of use for this, but here it is just being done as a protocol. We change the needle, put a thinner needle, extract the remaining 1 ml, that is 5000 IU of heparin mixed with 5 ml of saline or distilled water. This is locked and kept away. So this will be used at a later stage. You must remember to keep the cap of the syringe in hand, and that is maintained, restored. Now we open the IAOS EBOO flask that has got a big circle, a small circle and a plus on top and bottom. The top is identified by the stainless steel pipe that is attached to the stopper. A sterile artery forceps is removed from its packing, and we use this to clear off the aluminum from the spots where we need to insert our transfusion sets, ozone and the waste tubes. The double-ended EBOO flask is now prepared and primed. The donor set is now unpacked and primed. The middle part of the donor set is inserted in the perfusion pump, and the steel spike is inserted from the top end of the tube. So I have written these steps so that when you are watching the video before doing the procedure, you can go back and go to these steps, and the next video will tell you clearly how we are doing the process. So we cut the donor tube. This donor tube is very simple. It has only 3 attachments. One is a bivalve that goes into the patient's body. Attached to the bivalve is a drip set that goes to the heparin. So patient's blood and heparin, or subject's blood and heparin, or my blood and heparin in this case, is going to be sucked together. The entire tube is made up of very high grade, very costly medical silicone tubes, and at any level we can attach this tube into the perfusion pump to suck. So first of all, we have primed the transfusion set for the heparin, and then we are priming the transfusion set for the blood, and we now open up the perfusion pump, put the tubing at any level. It can be pulled up and down to any distance, and into the top of the bottle, where already the waste tube and ozone tubes have been pushed in, we are pushing the steel spike that goes right in. The waste tube is at a higher level, the blood in tube is at a middle level, and ozone bubbling tube is at the lower level. That is based on principles of physics, and in the book you will find full details of the same. We now lock the machine and switch on to see that it is flowing, which tells us that the direction of flow is correct. Now is the time when the subject sits on the chair. The bivalve must be within free distance the donor vein. A tourniquet is applied. The tourniquet must be a venous tourniquet. We use an elastic tourniquet. It should not occlude the arterial blood, and we can use an 18 or 20 venflon. We have now started trying 21 venflon as we treat our veins very delicately. The bivalve is connected to the venflon once it is in the position, and the pump speed is adjusted so that the blood flows into the EBOO flask. Now we can see that a tourniquet is being applied. The vein is being identified. And a cannula. In this case, a green venflon, because my veins are good. We don't even need a vein finder. Goes in. We are right into the vein. The bivalve to the machine is connected. The knob is twisted in the right direction. Heparin flow is started, and the pump flow is started. The venflon cannula is now secured to the vein. At this stage, we can increase the speed of the machine to about 12 to 14 ml per minute, and later, once the process starts, we can go up to 18 ml per minute. Right now, 12 ml per minute of my blood, which is heparinized, is getting into the bottle, and you can see that the blood is rising up. We now start the ozone. The moment the tip of the diffuser touches the liquid in the bottle, the tip has touched, and the ozone, we are using 1/8 of a liter at switch 9. So ozone has started bubbling into the bottle almost the same time as blood has touched the tip of the diffuser. We are not using renal filters. Renal filters are ancient and mentioned here only to be condemned. They are wrong methods of doing an extracorporeal blood oxygen ozonization. The moment the diffuser tube tip dips into the heparinized blood, ozone is started. So we can see that the regulator is put at 1/8. The machine puts at switch 9 and ozone is bubbling into the blood, and as it bubbles, the color from venous blood is changing to arterial color. So here is how blood mixed with heparin is being pumped into the bottle while ozone is being bubbled into the bottle. Here I am explaining to my staff the procedure, and of course my belly looks big because the seat or the chair is in a specific position. We now increase the speed to 14 ml per minute, and the blood flow is very comfortable and nice. This is the recipient site, recipient set rather. While the donor blood is being ozonized, we begin priming the hydrogen infusion, because hydrogen has to be primed for a minimum of 10 minutes and a maximum of 20 minutes to ensure that it is super saturated with hydrogen for our IV infusion. 100 ml of normal saline is hung on a drip stand. 2 air vents are pushed into the top, and 600 to 900 ml per minute hydrogen is bubbled into the bottle. A transfusion set is pushed in the bottom and it is primed. Hydrogen continues to bubble through. So while this EBOO is happening, hydrogen is being bubbled into the separate bottle which will be given to me after I finish my EBOO. So here we go. This is an air vent, another air vent. The bottle is only 100 ml and hydrogen is coming at 600 ml to avoid blasting or bursting the bottle. The hydrogen machine is started, it is connected and pushed through the bottom of the bottle. You can see the bubbles rising up, and the air vent ensures that the bottle doesn't blast. So this keeps continuing while our EBOO is happening. Transfusion set is pushed into the bottle, that is primed, and about 20 ml out of the 100 ml are removed so that we get enough space to put our vitamin C, put B complex, NAC, NAD, glutathione, whatever you want in the hydrogenized or hydrogenated bottle of the drip. Now the recipient set goes into the bottom side of the EBOO flask. So the recipient set is opened and this is pushed into the bottom of the EBOO flask in which the blood is being ozonized. It goes through the large circle in the bottom of the bottle. We wait till the bottle is half full before we attempt to cannulate the recipient site. A bivalve is now connected to the recipient site, and we can now cannulate a venflon into the recipient site. So, a bivalve is opened. This is twisted to the right direction for the flow. It's connected to the tip of the recipient site. Which is rubber free because we are now using an ozonated blood, and now we are ready to cannulate the recipient site in me. When the bottle is half full, the recipient weight is cannulated, and we first prime. Oh, I think this video has been repeated. So, I will, in the meanwhile, the nurse is injecting vitamin C into the hydrogen drip being bubbled, which you can see in the background, about which I forgot to tell you earlier. And we are now ready for priming the set and starting the transfusion. So, the set is now primed. We can see the inflow blood is very bright red in color compared to the outflow blood earlier, and the assistant is ready with the bivalve, where while the nurse is putting a venflon to the recipient site. The vein is identified, and here again we are using an 18G venflon. We could actually use even a 20G venflon because RBCs and WBCs pass through up to 21G venflon and can be used for blood procedures. The recipient part is connected, and we can see the bright tomato red blood which is ozonized without filtration. We open up the flow to ensure that the vein is intact, and then the recipient site is anchored properly. Of course, we must remove the tourniquet on the recipient site to allow free flow of the blood on the recipient site. We can see the flow is so comfortable. UV lights are switched on, and we wait till the flask is half full of the donor blood. Now we can see the process of how the blood is going from my donor vein, going into the bottle, how it is ozonized, and how without filters, pure ozonization clears the blood, hyper oxygenates it, changes its color to arterial color, and how it is going into my recipient site. We wear UV protective goggles, and the ultraviolet light is switched on to start the procedure. So, once the ultraviolet light is switched on, We have to wait for 15-20 minutes for the procedure to be over. This is the setup. You can see.
I am taking a reason for myself. You can see the donor side. The blood is going through the pump, going up, getting ozonized, and then the ozonized blood is going into my body. In this session, I am taking 8 to 10 lakh micrograms of ozone, which will probably be one of the highest doses of ozone ever administered. I have now already taken 6 lakh micrograms, and another 10 to 15 minutes I will conclude taking 10 lakh micrograms. Thank you.
How to calculate the dose that is administered in the blood? At 1/4 liter, O2 flow at 90 micrograms per ml of ozone dose flows. In 4 minutes, 1 liter of O2 with 900,000 micrograms will be absorbed by the blood. In 40 minutes, 9 lakh micrograms, not 900,000, 9 lakh micrograms are absorbed. Even after the donor side is removed, ozone continues to flow in the EBOO bottle. And in this session, the ozone flow was stopped after 10 lakh micrograms were administered into me. This happened 3 days back, and I cannot express my energy levels or the age reversal that I have felt in such a short time. Once the desired dose has been administered, the following are the steps of disconnection. You can see that it is 1/4 and the blood is coming from the donor side. This will show you that the calculation I told you is correct, and the amount of heparin exhausted so far is very, very less. So, to disconnect, the ball is taken off, heparin is switched off, tourniquet, the machine is switched off, the tourniquet is removed, and now the bivalve is removed from the vein and closed with a lid. Sometimes the sticky plaster gets stuck to the bivalve, and we must remove the sticky plaster to allow that bivalve to come out. Once we remove the bivalve, we can disconnect the heparin, lock the Venflon to stop overflow, disconnect the heparin, turn on the bivalve to put the heparin off the circuit, throw away the heparin bottle, when in which out of 500 ml hardly 75 ml have been used. The machine is restarted and speed is increased so that all the remaining blood in the tube is pumped and flows directly into the bottle. You can see on the other side that hydrogen is still bubbling, where nutraceuticals and vitamin C have been already added there. Once the donor tube is empty, we reduce the speed to get back to 8 ml per minute for the next patient, and then the bivalve is locked and it is disconnected from the machine. Yes, it is locked and is disconnected from the EBOO machine, and this is also used as a spare waste tube for allowing the spent gases to dissipate into the system. All this while, the blood is still being ozonated, and we calculate the dose of ozone from the time when ozone was started to the time when ozone is exhausted. This is clearly showing the setup. As the UV has been switched off, the spectacles is taken out. Upper right hand corner you can see the hydrogen being still bubbled, which I will be getting a little later. And now that the donor site has been disconnected, recipient site is started at full volume, and the hydrogen is hydrogenated, and hydrogenating nutraceutical solution is shifted to the other side of the drip stand. Hydrogen still continues to bubble. Only after this blood is exhausted will we start the hydrogen infusion in the body. We can now see that the bottle is being emptied, and once the tip goes above, ozone is stopped and the remaining blood is allowed to enter my body. No destroyer has been used, no ozone destructive mass have been used, and there is no smell of ozone in the room, which clearly indicates that whatever ozone has gone in has gone into my blood. The last of the blood of the flask is allowed to flow back into the patient, and then the recipient cannula is also removed. So, we are now removing the donor cannula while the last of the blood is flowing into the body. But it is very important to tell the patient or subject that here we are going to put the nutraceuticals on this side, so we have flushed it with dilute heparin, which we had to create it before. We are waiting for the blood, ozonated blood, to go back into my body, and once it reaches the level of my heart, it will stop flowing. After this, we connect the nutraceutical mix, which is primed and ready for infusion. This is going to be connected, and the recipient side can be removed at a later stage. The recipient side has been removed. The nutraceutical drip has been attached, and I myself open up the drip which is going in my body. We wait till half the bottle is over. 1.2 grams of glutathione, we use hydrogen packed glutathione, is dissolved in distilled water and added to the cocktail. So here Arunima is mixing the glutathione with the cocktail, and once that is dissolved, that will be added to the hydrogen nutraceutical drip which I am taking. So it is mixed into the glutathione. This is a real time video where no speeding up has happened, and the complete process is shown step by step. In the background, the nurse is preparing for the next patient who needs an EBOO. Now we are putting 1.2 grams of glutathione in the saline solution. Some patients may feel a little burning or pain when glutathione is administered. My pain tolerance is rather high, so I don't feel much of that. Donor site venflon is removed. The site is taped under pressure. So here are the steps. The venflon is removed. A small padding is put, kept under pressure, and later a adhesive thin bandage is added with instructions to not remove it till the evening. The big scratch you see on my hand is from my Persian cat who sleeps with me in the night and is very playful, digging me. Once the drip is over, the same is done to the recipient site. So we can see that venflon is removed and an adhesive bandage is put. As heparin has been used, we always advise the subject and patient, and even in my case, that we retain these adhesive bandages for at least 4 hours to ensure that we do not find bleeding. So here I am after the procedure, feeling happy and healthy, and this is me in a 2x speeded video the next morning, walking in the jungles with my dogs. My walking improved dramatically. I was able to do 11-12 kilometers and probably cross 900 kilocalories in that day, which was yesterday. Today the day is not over and I still have crossed 760 calories. This is the place where I live, and this is my dog Luna. So you can see that the records from my watch yesterday and today show a dramatic improvement compared to the previous days, and we can also see my standing hours, distance, steps 17,000 or 16,000 per day distance more than 11 kilometers. If you want to learn more about ozone or hydrogen, please message me in WhatsApp. This video is not meant for patients. This is meant for doctors. Our IAOS channel is primarily a teaching channel for doctors. And if you are a therapist or a doctor, if you are interested in learning the procedure and also learning how to benefit your patients, please message me in WhatsApp. Send message only. Please do not call. This is a number to send a text message or a voice message in WhatsApp, and I will be replying to you within 6 to 8 hours depending upon the schedule or the time of the day or the night. Thank you very much for watching this video. It has been a great pleasure making this video, and I hope that you had an equal pleasure watching this. Thank you very much. Thank you.